Hello, hello. Can everybody hear me? Great. Okay. All right. Just gonna move this over here. So, oops, didn't mean to do that. Okay, and there. Okay. All right. So, I have done a short kind of introductory symmetry presentation a while back, and I've cleaned it up a little bit. I know a little bit more. I feel a little bit more confident in what I'm doing. I've been practicing now for year and a half with the program. So wanted to just talk to you a little bit, let you look at some of the data that I collect and how it's used in the program and exactly why the program was designed and how it can help you help people that you know with things that might be going on in your body that you don't maybe have answers to or you've been plagued with for a long period of time. So we're going to I'm just going to talk a little bit about what symmetry is all about. I'm going to talk to you about how I got into it and how it has helped me. And then we can kind of go from there. So first of all, what is symmetry and what makes it different? First, symmetry it is a patent pending program. It was developed about 27 years ago by a practitioner out in California. His name is Patrick Mummy. I know that's kind of a funny name for Halloween, right? But he was a Division I athlete. He was headed toward the pros in baseball, and he was constantly plagued with injuries all the time. And he would go into the training room, he would get taped up and massaged or whatever he needed to be able to get back out on the field. And sure enough, he'd get re-injured. So he questioned as to why these injuries always plagued him, reoccurring injuries. So he started developing this program. What we're really looking at is what is wrong with our posture and how can we address those postural issues as a way to get us out of a cycle of pain or discomfort. All right, so the program has an assessment part to it where I'm actually measuring people to see what is out of alignment and then assigning corrective exercises to address those issues. Now, there's some things that we can definitely correct. So, for instance, if somebody's pelvis is out of alignment, or they come to me and they say they have a leg length discrepancy, my question is the leg length discrepancy something you were born with? Usually, the answer to that question is no. Okay, so then why is there now a postural leg discrepancy or a leg discrepancy, leg length discrepancy, right? Well, possibly it's coming from your pelvis being out of alignment. So I'm measuring things like that. I'm measuring to see if your scapula are aligned the way that they should be. I'm looking to see if you're rotated forward with your pelvis or with your shoulder or with your torso. Improvements in posture are going to be able to make you move more efficiently. And that could be just because you want to take a walk around the block, or it could be because you're participating in a sport. The routines are individualized to you. So after I take the measurements, the routine that is generated by the program is specifically for what is going on in your body, for the postural discrepancies that I'm seeing. All right. And I have the ability, once the program generates the exercises, to look and give a thumbs up, thumbs down if I think that's an appropriate exercise for you. All right, there's some things that the program may generate that I have to say, you know what, I know this person has a hard time getting up and down off the floor, so I don't want there to be exercises where they're constantly having to get up and down. So I have the ability to override and to also change. I have in the program itself, I have close to 450 exercises to choose from, and in those, there's several families where I may have 20 or 30 different variations. So there's a lot of wiggle room in there for me to be able to make sure it's completely adapted to you. Um, there's also a messaging system in the program. So I give you the routine. The routine has a video that goes along with every single exercise. And if you think, Kari, this exercise is not a good one for me, it's bothering my neck, it's bothering my back, I can't, kneel as asked because my knees are bothering me. I can change that. And you can message me and tell me that something's going on with that. There's also surveys that are embedded into the program. So I'm getting feedback as to how you feel the program is going for you. And then also, what I love about it is that I can check on everybody's compliance, right? Because that's usually the biggest issue when you get into anything like if you're in PT, physical therapy, and they give you exercises, compliance is always the issue. So I can look at your compliance and you can look at your compliance so that I know if you're doing the exercises or not. So, for instance, I had somebody that checked in with me a couple weeks ago, and she's like, "My knees are killing me." And I looked at her compliance; it was 7%. I'm like, "Have you been doing your exercises? Because the Symmetry program's telling me you were only 7% compliant." She's like, "Well, no." And I'm like, "Okay, well, that's why your knees are hurting you." So, and she was like, "Well, you're right. They weren't hurting me when I was doing them." So, okay, sometimes you just have to be told. I get it. All right. One of the things that we think about when we look at kind of what happens during the course of a person's lifetime, if you look at an infant, all right, from the day that they're born until they're a year old, there's just incredible changes that go on during that first year of life. And you start with an infant that can't basically move. They're on their back, they're on their stomach, they can barely even move their head because it weighs so much. And over the course of a year, they can roll over, they can crawl, they can sit, and they can stand. And so, what have they done in that first year of life? Well, obviously, there's a lot of growth within the brain that's happened to be able to get them to be more coordinated and also to become stronger. But we've all had to learn how to deal with the force of gravity acting on our body during that period of time. And so there's been a lot that has to be overcome in order to be able to get to those first steps that a baby takes within that first year of life. What we also see is that up until about the time a child is 8 years old, if you were to measure their posture using the system that I use, there are very, very few postural discrepancies. And why is that? Well, because, what do kids do when they're little? They play and they're outside and they're running around, hopefully, and they're playing sports. And that's, they're up and down. They don't like to sit for extended periods of time. But then once kids start school at 5 or 6 years old, then they're not sitting. They're sitting much more than they're standing and they're moving around. Now we have kids that come home and they're sitting in front of a TV or their device more than they should be, and they're not as active. And so those postural discrepancies that we see in the pelvis and in the shoulders, we can start seeing those at about 8 years old. And Patrick, who developed the program, he actually did a study in one of the elementary schools that was in the county that he lives in out in California, and he measured the first graders and then he followed them through until the third grade, and he's got data that shows how much posture changes start and are starting at that early of an age. Now, add several more decades to that and a lot more sitting and less activity, and you can see the pattern would be that we get more and more out of whack in terms of our posture as the years and the decades add up. So what we're trying to do is get you back to, in some cases, what happens during that first year of life and getting you back to less postural discrepancies by doing these corrective exercises. Now, what's interesting about the corrective exercises, and you'll see this when I show you some of the examples, is that how am I going to start people? A lot of times they're starting on their back, just like the infant. And then as we progress through, we can go to kneeling, we can go to crawling, we can go to standing, we can go to sitting and then to standing. So we see the progressions of the exercises go through very similarly what we see during that first year of life. Okay. Let's see here. One of the benefits of the program is that we are measuring. Probably most of you that have been through physical therapy programs, or if you go to a chiropractor, and I'm not saying that any of those, I'm not trying to put anybody out of business. I think they're all good, but I'm just putting numbers to what I'm seeing in your body. I have a lot of people that are still in physical therapy, or they still are in chiropractic, or they go to an acupuncturist. And I'm like, take the data with you, show them what I'm doing, because they're seeing the same thing I'm seeing. They're seeing that there's something wrong with the alignment of your pelvis or the position of your scapula. It's just I'm putting numbers to it and I'm showing, okay, this is what we're doing, and this is how it has changed from one measurement to another as we progress through the program. Um, the other thing is you need to ask yourself, you know, how do I know that I've made progress in a program? So if I'm in PT, obviously, if I go there because I was in pain, I want to, at some point, I'm just going to try to change the lights a little bit better here. I want to change so that I'm in less pain. Is that how the only way that you're measuring? Does my injury keep coming back? Why does an injury, for instance, always happen on the same side? I was always plagued with stuff going on the right side of my body. Is it always happening to the same joint? So, you want this is one of the reasons why we want to see, where's the problem? How can we correct it so we can get you out of this recurring injury cycle or pain cycle? It's very objective, right? I'm not guessing. I'm taking a measurement and this is what the number is. This is where you are today when I'm measuring you. And you're going to go home and do these exercises. You're going to come back. I'm going to measure you. We're going to see how those exercises have changed what the postural discrepancy was. The other thing that I do a lot of, especially when I have a person that first comes up, is that we'll go through all of the exercises after I do the measurements and generate the program. And then where the biggest postural discrepancies were, I will take those measurements again so that you can see, even in just an hour here and doing the exercises, you've made some shifts in your posture. The problem is you're going to walk out the door and they're all going to go back to where they were because your muscles are have really good memory and want to bring them back, which is why the exercises need to be done regularly. Um, so the corrective exercises are prescribed, as I just mentioned. And the other thing that I love about this program and how it worked for me as well is that I'm giving you, the client, the power to correct what's wrong. You have the tools to do it, and you just have to do it. Okay. It's not that you have to keep on relying on going back and to somebody, or I have to fit time into my day in order to be able to get someone to help me make these corrections. You've got the power to help yourself. When I'm measuring, and these are just a few examples here. So if you look in the on the left side there, I'm doing a measurement of iliac crest. So I'm measuring the hip or the pelvic bones and to see if one side's higher than the other. You can see in the middle picture, I'm measuring to see if one scapula is higher than the other. If you look at this picture, which this is my son, and he is a potter, so he's over a potter's wheel all the time, you can see how his upper back is rounded. So his scapula are quite protracted, which is one of the things that we're working on. And guess what? He has a lot of shoulder issues as a result of his posture. He's strong, he's super strong, but his shoulders are completely out of whack. And the other thing, when we look at the lower in the bottom, I'm measuring there to see valgus or varus in the knee. So are you knock-kneed or are you bow-legged slightly, severely? And so we're measuring that angle in order to be able to make some corrections there. A little bit about me. I'm not, have to read all this, but I'm just going to kind of just go over how did I get involved with Symmetry? Well, I was doing a workshop for some personal training CEUs, and it was online. It was during COVID, kind of towards the end of COVID, and in 2022, and I came across Patrick and Symmetry, and I did a couple of informational workshops with him, and I was like, I was having a lot of problems with my knees. And I thought maybe this could help. But as I had mentioned earlier, I've always had problems on the right side of my body. It was my knee, it was my hip, it was IT band. It was always happening on the right side. And I eventually ended up tearing the meniscus on the right knee pretty severely, and I had to have surgery to repair it. It was not going to get better on its own. After I had the surgery, I rehabbed it. It was I was rehabbing it during COVID, so I had plenty of time. to do what I needed to do, but it still wasn't getting any better. So I had a hyaluronic acid injection in it. That's kind of like just a lubricant that they put in the knee. Still had problems, still having problems with it. And then I started having problems with my left knee, and that got pretty significant. And that was really painful as well. I went into the ortho. The ortho said, you know what? You're headed for a knee replacement. So, amazingly, I started getting all of these like I started getting solicited by health companies about how I could do a package deal for my knee replacement. And I'm like, I just don't want to go down that road right now. So Symmetry came at a perfect time because I was like, I want to try to do something else to deal with this. And so lo and behold, I go and get measured. I signed up to do the first level of certification with them, and I get measured, and a pretty significant disparity in my pelvis. So I've been working on that. I am not a candidate right now for a knee replacement. I'm doing okay. I can do the things I want to do. And so I will have to say it's played a significant part in me understanding that when something like that is going wrong with my knees, like why were my knees getting so worn out in the joint? It had to do more with the discrepancy in my pelvic alignment. All right. So I had one hip that was rotated more forward than the other. I had one side of my hip was elevated more than the other. And so the bones that come out of my hip to my leg, my femur bone, was not in the joint correctly. So it was wearing the joint down more so on one side than the other, to the point where it was wearing through the cartilage. And so I corrected that misalignment in my pelvis, which then allowed the femur, as it enters the knee joint, to track more correctly. So now I am wearing the joint more evenly, which is causing me to be in less pain. Okay. Um, so I just want to kind of have you look at what the measurements are and what I'm looking at here. So this was the Symmetry office people taking my measurements. And I want you just to look at, first of all, that there's three different planes here. We have the transverse plane, we have the frontal plane, and we have the sagittal plane. The transverse plane is a rotational plane. Okay, so if I'm looking, the transverse plane is a horizontal plane. Okay, but if I have something that's out of the transverse plane, it's a hip that's elevated. Okay, it could be my hip is rotated too far forward on one side versus the other. So I could have one that's rotated forward, one that's rotated back, or just one that's rotated more forward than the other. I can have a scapula that's more elevated. That's out of this horizontal transverse plane. If you look at my score, this PSIS, ASIS joint, that is, I'm measuring from here to back here. I'm looking for how tilted my pelvis is. All right. We want to have a tilt forward versus somebody that's got their tailbone tucked underneath them. Okay. You want to have a tilt forward. That promotes a little bit of a curve in your lumbar spine as well. If you look, I had a 2-degree tilt on the left and a 4-degree tilt on the right. Ideally, this should be 10 degrees. So almost no tilt in my pelvis. My iliac crest score, I was only elevated on the right side by 1. So this is looking at my pelvis from the back here. Okay. And if one hip was hiked up, right? Not bad. Scapula elevation, not bad. My total score in the transverse plane was 9. The maximum score in the transverse plane could be 27. This is like playing golf. The lower is better. Okay. 9's not bad. Now look at my frontal plane score, 14 out of 27. All right, more than halfway there to the max score. And rotation in my pelvis forward. So if you're looking at me standing facing you, I was rotated forward. Okay, actually I was rotated forward right. But so I'm standing crooked basically. I'm standing with a twist, like a corkscrew. And then my torso rotation was left forward, so literally like a corkscrew. Not super severe. Forward displacement, though, was pretty bad. Forward displacement would be if I'm standing and I'm leaning forward and my pelvis is forward like this. Okay. So I'm leaning a little bit too far forward. That score is pretty high. And then my scapular protraction score, that's, yeah, I showed you that picture of my son where he was very rounded in his shoulders. So it was 8 centimeters and 7 centimeters. Ideally, these should be 5 to 6 centimeters. So a little bit out there. If we come over here to the sagittal score, okay, sagittal score is where most of us feel pain. All right. So the sagittal score is moving. If I was to cut your body in half, left and right parts, it's a deviation out of that plane. So if you think of somebody that has scoliosis, where there is a curvature in their spine, that is a deviation in the sagittal plane. Knee pain, ankle pain, foot pain, all in the sagittal plane as well. And that's where a lot of people's pain manifests, but not necessarily is where it's starting from. So spinal offset score, so my neck is crooked and my thoracic spine is crooked. Luckily, my lumbar spine was not. My legs were varus, which means they're slightly uh, bow-legged. All right. So my knees would be slightly out, which goes along with what's going on with the wear and tear in the cartilage, because uh, I have some wear both in the medial and laterally, and my legs compensated for that. And then a lot of internal rotation on the left leg, and the left leg was really, really hurting me when I got measured the first time. So that's my kneecap was internally rotated 8 degrees. Yeah, no wonder it was hurting. And then looking down at my feet here, I was a little bit everted, which is pronated in my foot. Okay. So total score, I got 35 out of 81. Against lower is better. Okay. So I do have some people come in and they're up in the 60s, and they're usually walking in the door in significant pain. So the other thing that we're looking at with this is how big of a difference is there between the scores here. All right, so here's a 9, not too bad. 14, out of 27, more than halfway there. 12 out of 27, close to halfway there, out of 27 points. So these two scores are telling me that there's a lot of discrepancy, medium discrepancy in these two areas, kind of low in that area. All right. So what do we do with these numbers? Okay, we try to get to the next slide. Here we go. So I'm going to show you, this is the routine that was generated for me after my first set of measurements. All right, so I just kind of want to take you through what a routine looks like. Each one of these exercises that you see that are generated, there is a video that goes along with each one of them to show you how to do the exercise correctly. And I'm not going to go through them with you right now. But I had generated for my issues, there are 10 exercises in this particular program. Okay. Now, again, one of the things that I really love about Symmetry is that it's trying to educate you at the same time. All right, so you saw what my numbers were, you saw where my discrepancies were. And so, for instance, this position, me lying on my back with my feet up, what's it working on? Spinal offset and lumbar offset. I had offset in the thoracic spine. This piriformis stretch is working on that PSIS, that tilt forward in my pelvis, that was not anywhere near what it should be. That's working on that. This shoulder rotation exercise is hitting transverse and frontal plane, both of which I have issues with, right? So we're trying to educate people with the program as much as to make them feel better. But you need to know, so many people, like, they get the exercises. What are they doing? How is this helping me? I don't know. This tells you, like, we don't want to keep you in the dark. We want you to be informed. Sometimes there'll be some extra instructions in them, that we can put a block between people's ankles or strap up above their knees or something like that. So that these things you see in red are just other instructions for that particular exercise that I think are going to be helpful for that person with their particular disparity. And then as you go through all of these, you can just see like every single one of them is going to tell you, okay, this is what we're trying to correct.
Kari,
Okay.
we aren't seeing anything.
Oh my goodness. I'm sorry. Ah, okay. Thank you for letting me know. Okay. Let me get out of this. I don't know why that didn't show up, but I will not waste our time anymore with that. Okay. Are you seeing this picture? Measurement 16?
Yes, yes.
Okay, okay, good. All right. So apologies for that. Anyway, I just want to show you, this was my last measurement. So there's a set of 16 measurements through the course of the program. This was the last one. And again, out of a total of 27 is the max score in each one of these. My transverse plane is still at 9, but look at the difference in the angle of my pelvis. Okay. I started off at 2 and 3 degrees and now it's at 9.6 and 11.2. This is a little bit, that 11.2 is a little bit more than it needs to be, but that's pretty much spot on. Iliac crest elevation, scapula elevation, tiny little change in that. No rotation in the torso, a little bit in the pelvis, and this time it's left instead of right. The cervical offset is gone in the sagittal plane over here. And forward displacement is nothing like it was. I was like 5 degrees, forward in my pelvis. And then the scapular protraction came down and is better. My feet are looking better. And all of the leg scores here have turned to neutral. So, I was like 9 degrees internally rotated on my left leg. So big improvements there in the sagittal plane in particular. So, moral of the story is you get yourself straightened out and you're going to feel better. The other thing is that when I look across the scores here, it's a 9, a 6, and a 5. These are all pretty close together in terms of what it was prior to, where, I had a 9 and a 15 and a 12. And the difference between those scores was greater than it is now, just 1 point here and 3 or 4 points between the lowest and the highest here. Perfect score for me. I've gotten down as low as a 13, which that was a pretty awesome day. But then a lot of times if it gets down that low, it'll pop back up again a little bit. So, but you want to get into the 20s is my goal for people. If they come into me and their initial score is a 60, my goal for them when they finish the program is that they are in between 20 and 30. They're going to be feeling pretty good usually when they're in that range. Okay, let me go. I'm not going to do that. I just wanted to show you one other. This is a client of mine. He is 88 years old. This was the first time he came to me. He has a lot of back issues. And I just want to show you the difference. Here, his PSIS, ASIS score, negative 5.8 and negative 4.4. His tailbone completely tucked underneath him. And this is the typical person you see walk in the room and they have no butt at all. Glutes are disappeared. So he's standing. When you have that much of a tuck in your pelvis, when you're this far forward, your upper body's going to go like this. All right. And we've all seen people in this particular position. And the upper body comes forward because the tailbone is so tucked, they have to figure out how to balance their body. And so the upper body comes forward and then this happens, the rounding of the shoulders and sticking out their head in order to balance themselves. And you can see the scores here. They were not horrible. I mean, I've seen definitely worse than this, but you can just see in particular, this was a major issue for us, but I had to fix this frontal plane first because he was so tucked and he was bent at the waist and his head was sticking out, as you can see here, that I had to get him a little bit more upright and in order to be able to correct this. He's got, like I said, a lot of back issues. So this was a very, very slow process with him. And I took my time and we did most of the exercises I I give him even now, and we're well into the program now, are largely done on his back because I just need to keep him in a safe position. And he came to me without being able to do any kind of back extension. He couldn't lie on the floor without significant bolstering under his head and neck. And I actually had his physical therapist email me and she said, "What are you doing with him? I've never been able to have him put his head on the floor." And it was just, I was really addressing a lot of just these frontal plane exercises that had to happen before he could do any kind of back extension safely or lie on the floor without having to have his head bolstered up. So that was great. This is him. I just measured him. So he's at measurement number 12 now. He went from a 42, he's now down into the 20s. And just looking at this right here, although it doesn't look that fantastic in terms of the PSIS score here should be about 10 degrees rotated forward, he's at 2.1 and 2.8, which for him is phenomenal. Because if you think of where he was at a -6, and now he's at a 2.1. That's been a humongous change. That's been a 10-degree change in the tilt of his pelvis. And he's standing up a lot straighter here. His head's still a little bit too far forward. That's going to probably still take a little bit of time with that. But all of these scores, and the other thing is that you look at how close these scores are together, 9, 9, and 10 across the board. He walks in the door now and I'm like, "How you feeling?" And he's like, "I really feel pretty good. My back's not bothering me as much." And he's feeling a whole lot better in his body. And again, once we get people into the 20s, and for someone like him, with just the fact he's 88, he's had a lot of back problems for like the last 40 years. Him at a 28 is fantastic. Can I get him down to a 20? I don't know. I don't know if we can do that, but we are working on it. So I'm super proud of him. And he is so completely compliant. Again, thinking just about this picture that I threw in at the beginning here, we just want to get back to this good posture we had when we were toddlers and we first started walking around. And we want to just defy what gravity and sitting has done for us, and sports and everything else that we've been subjecting our bodies to. How does it work? We want to get, if you're interested, getting measured is the first thing, right? Coming in, getting measured, see where you are. Compliance to the program obviously is key. All right. My most successful people, if I look at their compliance, they are over 100%. We recommend doing the corrective exercises every day, twice a day. There's a short routine and a long routine for those people that don't have, exorbitant amount of time to spend on it. The programs, the routines, usually I can get through them in 15 to 20 minutes at the most. First couple times you go through the exercises is always a little challenging. And making a commitment. You're not going to start to feel the changes in your body probably until you get to the 4 to 6 week mark or the 4 to 6 measurement. Okay. The sixth measurement will happen at the 2-month mark. Usually I have people starting to tell me after they've been doing it for, a month, they're going to start to give me some pretty good feedback as far as like, "Oh yeah, I feel like I've got better mobility in my shoulders. My neck feels a little bit better." There are some aches and pains that'll come with it, just as any kind of workout that you do. What we obviously don't ever want to have happen is that you are in more pain. So even though you may think that the program is going relatively, slowly, maybe not at the same pace that you like to go, it's because we want to make sure that you stay out of any kind of pain cycle. So I thought I'd spend a little bit of time just going over some of the typical exercises that I assign. Usually what I see is this PSIS, ASIS disparity. So the tilt in your pelvis forward, more so on one side than on the other. It could be tilted back. It could be just that there's a big, not tilted forward enough or a discrepancy. So I'm just going to go over some of the exercises here and explain to you what they correct. And I'll give you a couple different varieties of or versions of the exercises. So I'm just going to move this down to the floor so you can see me a little bit better. Um, and if you want to get on the floor, that's fine. If not, I'll go over a few things with you. So the first one is the piriformis stretch, which a lot of you are probably familiar with. Okay. You're going to be on your back, and I'm going to take my right knee over or my right ankle over my left knee. And while I'm here, I want to feel both sides of my pelvis level on the floor. So I'm not rolled over to the left or rolled over to the right. I want you to think and visualize that your spine is nice and straight and that your hips are balanced. In this position, and don't worry about it, if you don't have enough flexibility to get your foot in or your hips this flexed, you can walk that foot out a little bit. That's not a huge deal. What I want you to do after you feel the hips are balanced, the spine is straight, feel your shoulder blades on the floor, I want you to just feel yourself move that right knee away from your body. Okay. And again, watch the balance in your hips. All right. So that you don't switch things up. Piriformis stretches are typically always going to be held for 30 to 60 seconds. All right. And you want to make sure that you're breathing. Breathing is always highly endorsed, but you want to make sure that you're taking relaxing, deep breaths. Okay. We're going to go ahead and switch. So I'm going to cross the left ankle over the right knee. Same thing. Go back and feel that balance in your pelvis. Weight is evenly distributed. Spine is nice and straight. Left knee is going to be, you're just going to actively move it away from you. You don't need to push it. I just want you to think left knee is moving away from your body. And we're going to hang out here for a little bit. Again, we're just breathing. The piriformis stretch is addressing, as I said before, the angle and the tilt forward in your pelvis. If I have somebody that has a completely tucked tailbone, this is not I'm not going to start them on the floor. I will probably start them with their legs up, okay, up against the wall or resting on top of something like their coffee table or a footstool or something like that, a comfy footstool, so that their back can be a little bit more relaxed. All right, we're going to come out of this. I'm going to do one more version of this piriformis stretch. I'm going to go back to crossing my right ankle over my left knee. Find the balance again. We're going to focus a little bit more on keeping that balance in your shoulders because in this particular piriformis stretch, we are going to take both legs over to the left so that my right foot is on the floor. Okay. Now, if you can't get all the way over to the right, then it would be appropriate for you to put something like a yoga block underneath your foot. Okay, just to elevate it up a little bit. And then while I'm here, I'm going to take that right knee and I'm going to go back and forth with it. All right. I'm going to keep those shoulders on the floor. So I'm working directly in where the femur comes into the pelvis. All right. I'm working on mobility and flexibility in that joint. And what I want you just to think about, and you probably felt this in that last stretch as well, is that one side's going to be probably a little bit different than the other. Right. So just thinking about like how mobile does this side feel when I'm moving this knee back and forth? All right. And again, what are we working on? That tilt in the pelvis. We're going to uncross there. We're going to come back over to the other side. Okay, I'm going to cross that left ankle over the right knee. And now I'm going to take both legs over to the right. And then I'm going to do the same thing. I'm going back and forth with that knee. Now, sometimes on the side that has more of a tilt forward, this feels easier. However, if it's tilted completely back, it probably won't. Okay. You might feel like it's a little bit tighter, a little bit less range of motion. That's on the side that's tilted back more so than tilted forward. Okay, so those are two ways to with a piriformis stress stretch to address that PSIS ASIS issue. TFL stretch is another one. So if I have measured somebody and one side of their pelvis is up higher than the other, TFL stretch is a really good way to address that. And what I'm going to do on this one, we're going to go back into that crossover where I had that right ankle over my left knee. But this time, instead of going to the left, I'm going to go to the right. All right. More than likely, that left knee is not going to touch the ground. I do want the shoulders on the floor. Okay. And this is a stretch that we would just hold and breathe. Okay. So we'll hang out here for about 10 more seconds or so. And this is another one where you're going to feel probably an extreme difference from one side to the other. And when you feel that difference, since we don't have measurements on anybody, that's just an FYI to you, like there's something totally different going on from left to right here. And it probably has something to do with the angle of my pelvis. And most of the disparities, because you have your legs that go obviously from the pelvis down, and then you have your upper body appendages and your scapula and so forth that go from your pelvis up. If the pelvis is out of alignment, it throws everything else out, right? Let's go ahead and switch. So that's why we talk about it quite a bit. So I've got my left ankle over my right knee, and now I'm taking both legs over to the left. Okay. And so, for instance, for me, this is a way bigger stretch, both on the inside of the left leg and also on the outside of the right hip. I feel this a lot more. And my issue is always going to be that the right side of my pelvis doesn't want to tilt as far forward as the left side does. So it's something I have to constantly just be reminded of, but at least I know that's what the issue is. Okay, we'll hang out here. Just a little bit more. All right. And then we're going to come back to center and we'll move on to the next one. So the next one that we're going to do are hip rotations. Okay. So over here. So one of the, this would be to me one of the first hip rotations that I would give any client. I'm on the floor, right? So I'm in a safe place as far as I have stability in my shoulders and in my pelvis. I'm not going to be able to twist or turn. And because I've got the floor to help keep me balanced and settled, I'm going to take both legs over to the right and then both legs over to the left. Right now, I want my feet, they don't have to be touching each other, but I don't want them any further than hip width apart. And I also want you to find your breathing here so that you're inhaling in one direction and then you're exhaling in the other. Again, this one is for hip rotations. This one is going back to addressing the PSIS ASIS disparity more so than iliac crest elevation, okay, which is what we were doing in the last one. So even though it's a side-to-side movement, we were doing a stretch versus a more active, what we would consider an active isometric exercise here. All right, we'll do a couple more right here. When we look at the exercises in terms of repetition and time, most of your stretches are going to be in the 30-second to 1 minute hold. And most of the repetitions when we're doing something like this particular exercise, or we were doing the piriformis exercise with the knee going back and forth, you're looking at 10 to 20 reps. And it just depends on kind of the difficulty of the exercise. So this one would be a 20 rep. Okay. And so we can stop right there. Um, Cats and dogs. All right. So we are I'm actually going to add another one in here since we're on our back. And you're going to be lying on your back with your knees bent, and we're going to do shoulder rotations. So shoulder rotations, if you saw that measurement of my son with his very protracted shoulders, this is definitely one he gets all the time when I measure him. You're going to take your middle three knuckles. You're going to put them right at the temple of your head, right? And we're going to go ahead and bring the elbows over your chest. Do not worry about how far or how close together they get here. I am more concerned with you being able to come back towards the mat as far as you can. And I want you to feel your shoulder blades squeeze together when you do that. All right, so we're going to exhale together and we're going to inhale open because I want you to be able to open your chest and use your breath to help you with that. If your elbows don't go to the floor, that's not an issue. I want you to think about scapula and I want you to think about your shoulder blades and feeling them come together towards your spine. That's where your focus goes. So this is helping to get the scapula to go into the position they should be in, which is down and back, and reminding your body that the scapula should be retracted rather than protracted. Just kind of my experience dealing with people in personal training that end up with shoulder issues. Most shoulder issues and shoulder injuries are a result of the shoulders being protracted away from the spine, and that causes other very small muscles to have to take over strength in the upper part of the arm in order to get the job done. And it could be something as simple as throwing a cardboard box over a fence so it goes in your recycle bin. I've had somebody take their shoulder out doing that. It could be putting a can of beans up on a shelf. It doesn't have to be any kind of massive strength move, but we want to make sure that those shoulders are reminded to go back where they are, and you can rest right there. All right. Cats and dogs, we're going to do this on your hands and knees. When we're in this position on the floor, it's not possible for me to rotate my hip forward or a shoulder forward. All right, so I want you to think about having your arms straight and locked out. I'll take this so you can see a little bit better. Okay, so we don't want the arms bent. I want you to have them straight. All right, you are going to exhale, round your back, and then inhale and lower. The difference between how you normally are cued in for this and the way we cue people in is that when I am coming down into this position, I want to feel those shoulder blades together. All right, my chest is coming down towards the floor. The shoulder blades are squeezing together. When I exhale, I'm rounding up and stretching. And then inhale down, squeeze the shoulder blades together. Make sure that the elbows stay locked out. So exhale and then inhale. You can add movement in with the head and the neck if that's comfortable for your neck. Okay, so always being cautious about what you're capable of, but every time after you come up, come down, squeeze the shoulder blades together. Exhale up, inhale, squeeze. Exhale up, inhale, squeeze. All right, and this is usually one that we do a 2 times 10 with this, but just retraining again the scapula. Cats and dogs are great for scapular retraction, so getting the scapula where they need to be. So it's both working in the transverse plane and in the frontal plane to help with the scapula. It's also a great exercise to help get the alignment back in the spine. So if there's a deviation in the thoracic, lumbar, or cervical spine, so neck, upper back, lower back, this is an exercise that helps to straighten that any of those deviations out. Okay. The next one is hip abduction and adduction. So I'm going to talk about these a little bit. One of the things that you need to have for the exercises is a strap. This could be a yoga strap, but it needs to be a non-stretchy strap. Okay. The other thing that we use is a yoga block or any kind of block. These are the blocks from Symmetry. They're like gigantic blocks. So for little people, a yoga block is better because these are just like giant size. But hip abduction would be a strap that would be above my knees here. Okay. And I can do this one. This one I'll just do on my back. I would be pressing out on the band. Okay. So pressing and releasing out on the band. And we would do that for up to 20 times. So I'll show you the adduction is pressing in. So this could be, I have people use yoga blocks. I also have people use a yoga ball, which I use a lot in my virtual classes. That works as well. This could be a cushion. It can be a pillow. So on your back here, and we're just going to squeeze in on the block and then release. What am I thinking about while I'm doing this? Do I feel my pelvis level on both sides? Do I feel my shoulder blades on the floor even? So I'm not rotated at all off the floor. I want to really even myself out. Feet, the contact with the floor, you're going to feel them slightly pigeon-toed in, and you're going to squeeze and release. Okay, so it's important to think about the position of your feet. You don't want to be splayed out. You want to have your feet straight, because if your feet are straight, the knees are going to be more likely to straighten out. For me personally, there's a lot of hip adduction in my programs. Why? Because I have an externally rotated knee. I don't want to encourage external rotation. I wanted to encourage the knee to come back into center and be straight. So something like adduction here, where I'm squeezing in on the block, is going to strengthen the muscles on the inside of my leg. It's going to help my leg to track a little bit straighter. All right, so understanding why you're doing a particular exercise and for what reason, again, is part of what I really love about the program, is the educational aspect of it. And so that you become informed as to why you would want to do something. Okay. Leg adduction also is helping with any kind of frontal plane deviation. So if you're rotated forward in your pelvis, when you're standing up and your pelvis is rotated to front, to the left or to the right, that also helps to correct that issue, as does the leg abduction when I had the strap up above my knees. The last one that I have on here, which is sit to stand, this would be definitely a progression that you would see at the end of a program when somebody is, I've probably been seeing somebody for several sessions already, because this is considered to be a strength move. It's going to incorporate strength and balance with it. So sit to stand in the Symmetry routine. Okay. Here so you can see me. Okay. So I'm sitting here on the end of my table, chair, whatever it is. My hands are going to be on top of my head. All right. First thing I'm going to think about is, where are my feet? Look down at them. Are they straight? All right. And my hands are on top of my head. Why? So that I'm not going to be using them out here for balance. Okay. So again, this would be a much more challenging exercise here. And I'm going to be coming up into a standing position. And then I want to make sure that when I come back down, it's controlled. And also I'm keeping the balance in my feet as I come down. Okay. We want to do an exhale on the way up. Think about your feet. Make sure the weight is evenly distributed. And then keep that weight evenly distributed and come back down. All right, check in with your feet again. Weight is evenly distributed, and you're coming back up. What I might do with somebody, for instance, in my case, where I am externally rotated, I may put a block in between their knees. And also if I see somebody when they first start doing this, that they tend to move their knees either in or out too much because there's a little bit of a strength issue coming up or a lack of core engagement or involvement, this will help to get the inner thigh, which is connected to your transverse abdominis, your lower abdominal muscles, involved. So it makes your core have to work. And a lot of people will say, oh, well, that's so much easier if I have the block between my knees. And what's really happening is it's just allowing those lower abs to chime in and help you get up and down out of the chair. Okay. So that's just a little bit of some of the exercises and that are working in each one of those planes. There are 420 more of them. So there's many, many exercises I had to learn. That was the most challenging part for me. But anyway, that's like I said, that's just a little bit of what the program is about and how it works. There, when we look at like, oh, how long of a commitment is this, right? So, whoops, that's okay. That was my last one. So, let me go ahead and move that. All right. Usually what I want to see from people is a 6 to 12 month commitment with it. The first 3 measurements occur within the first month. So I have somebody that comes in, I do an assessment on them, we get the measurements. I also do a functional movement screen, which is not part of Symmetry, but it's for my personal kind of get to know your body and you get to know yours as well. Functional movement screening is usually, and this is for people that are capable of, doing things like walking up my stairs and doing some squatting, that are active people. And I would not I can't do a functional movement screen for someone who is completely deconditioned. It's like, how do you look in a lunge? How do you look in a plank? How do you look in a squat? Just gives me a little bit more information as well. That first session is usually about 75 to 90 minutes. I get the measurements. We generate your first set of exercises. I go over them with you, show you how the app works. The next 2 sessions will occur within a week. The only exception is to that is that I do have, for instance, that person that I showed you that scored a 42 and had a lot of back problems. We went every other week because it was too much information and too much for his body to have to assimilate new exercises every single week. And it would have caused too much discomfort in his body. So I just went very slowly with him. And I also have some people that are extremely deconditioned that haven't exercised, for instance, in like 10 years or ever. I will do them every 2 weeks because it's like having to get used to doing exercises is overwhelming for them and having to do them every day. So, but then after that, the measurements start to stretch out. So then after that third measurement, the next one comes in 2 weeks up through the 8th measurement. And then after the 8th measurement to the 11th measurement, I'm seeing them every 3 weeks. And then from the 12th measurement until the 16th measurement, I see people once a month. After they're done with the 16 sessions, if that's how long they want to do the program for, I usually recommend that they come in and get measured about once every 3 months just to check in. Because what of course happens is that after I'm not there checking to see what is your compliance, is that people get a little slack and they start not doing the exercises as often as they should. They might, get themselves into another pain cycle again. So I usually recommend and just say, come in once every 3 months after that, do a measurement, generate some new exercises, and then, okay, moving forward, this is, you're going to do these, and we're going to rotate a few old routines in as well. But that also kind of lets that person know, like, after I stop doing the program regularly, like every day, what goes out of whack right away? Is it my pelvis or is it my shoulders? Is it my spine? And that gives that person knowledge as well as this is what I have to be really careful of. Like this is where my body wants to go out of alignment, and then these are the problem. These are the problems that they cause. I have some golfers and I have some tennis players. Rotational exercises, you're extremely one-sided. They need to do symmetry, like they just need to do it every day because they're throwing themselves out of alignment regularly every time they play. And so the that's pretty much how we look at it. It's a 6 to 12 month commitment. The first part of the program, um, um, measurements 1 through 6 are considered to be corrective. That's when I'm seeing the most change occur in people's bodies. Then we get into what we call a strength phase. So the corrections have pretty much been made. The measurements are starting to stabilize. I want to get you strong in that with that new posture, with the new posture that you have, basically. And then the tail end of the program is maintenance. So we're still taking measurements every time you come in once a month. We're still making some corrections. There may be some big measurement changes that occur that we need to address, but that's what we call that maintenance program, and that's getting you ready to be kind of let go on your own. When you finish the program, when you get through number 16, you still have access to all of the measurements, all of the exercises that you have. And what we recommend at that time is that you just start cycling through. So you pick one routine from your corrective phase, one routine from your strength phase, one routine from your maintenance phase, and you do one on Monday, you do the corrective strengthening phase on Tuesday, you do maintenance phase on Wednesday, and then you start back with going back to that corrective and then strength and then maintenance. So you have variety within the program, but you're still keeping yourself active and you're addressing what we know are your postural discrepancies. All right, so I talked probably way more than I needed to. Happy to take any questions that you guys may have. Just unmute yourself, and if you have some things to ask, I'm happy to answer.
Well, of course, what is the cost for this?
So, so the first month, or the first 4 sessions, it's $380. That includes that first session, which is basically a 90-minute session and an assessment and going over the exercises, and then the following 3 measurements after that. I usually find at that point people will know if they want to make any more of a commitment, and then from that point you can purchase the next what would be 6 sessions, which will get you through the first 6 months. So you have an option at that point to do the 6 months, or if you want to purchase the 12-month program. The app is of no cost to you. That's my end. I pay for that. And the program would be $540 for the next 6 sessions, and then you just double that for the if you wanted to do the whole program through 16 sessions. So.
Would it be beneficial just to do what was it, first 3 months or 2 months?
So the first 4 sessions, so that the first 4 measurements, I think, it's beneficial, and it'll just let you know, like, is this something that you want to do, right? Do you feel like it's making an improvement in your body? And then if you want to continue, like, you can make that call at that time. So, I'm not going to say, obviously it's not, I always think it's beneficial, right? To know what's going on, what is going on in my body, what can I do to make things better? And, so yeah, I would say doing the first 4 weeks and then just make a call at that point if you need to.
Do you think it's possible to correct my kyphosis?
I believe we can definitely make it less severe at this point. Yeah, I think so. And I work with a lot of people. I work with a lot of people 75-ish and older that are pretty kyphotic, and it's going to take a little bit of time. Like I said, it's probably going to be, you're probably going to be into 4, 6 measurements before you're starting to be like, okay, I can really feel the difference between when I'm in better posture and not as kyphotic, as opposed to as kyphotic as you can, because we're doing a lot of frontal plane. You would have a lot of frontal plane disparities that we would be addressing right up front. That would be where the program would be focusing on. But with that being said, like we can't do anything super drastic, right? Because that's been a part of you for a good, what, probably 15 years.
At least,
You
yeah.
did, yeah. So it that frontal plane discrepancies, definitely I work with it all the time. I have people that come in all different phases of it. And what I typically find is that yes, but it is a process. Okay. It's going to take a while just because the spine is super flexible and it really wants to be straight. But there's also, with that much of a frontal disparity, your center of mass has changed. And so there's a lot that has to go on up here for your kind of reprogramming your place in space, because you've become completely adapted to being balanced in a more forward place. Your center of mass has changed from where it actually should be. So it's a process, but it's definitely addressable.
Hey, Kari, it's Dale. Where do you
Um,
do the measurements at?
at my studio,
At my studio,
outside of Meadow.
outside of. Okay.
Yeah. So this is my workplace now, and so everything's happening out of here.
Okay. Awesome.
Yeah, awesome. Anybody else?
Kari, it's Carol Hadler.
Hey,
So how are you?
I'm
um,
fabulous.
so I I I have a significant leg length leg length discrepancy from a very old injury 50 years
Mm-hmm.
ago that
Mm-hmm.
was ignored.
Mm-hmm.
And really, I just noticed it, which is so crazy, when my pants started to look like one leg was long and one leg was short.
Mm-hmm.
I was referred to a physical therapist, Michael Gross. He's on the
Mm-hmm.
faculty somewhere.
Mm-hmm.
And, basically said that the only thing that I could do so I wouldn't be totally out of balance was to get a significant lift put in the shorter legged shoe. And I was
Mm-hmm.
sent to Raleigh. The shoemaker did it. So I have
Mm-hmm.
two pairs of fairly ugly shoes, but they have a lift in the short. I mean, is there
Mm-hmm.
anything I'm trying to, do some, it threw me kind of out of whack to have now a difference. It's affected my spine, my blah blah blah, as you were saying. I mean, I don't think this is something that exercise can do, but maybe I'm wrong.
So this is how I would approach that. Um, you just noticed it. Like, I
I
mean,
have I
it
don't have
became,
right.
yeah, it just got to the point. So something else has shifted. Whether
Yes,
that's the spine, you now
it
have
is
what
for
we would
sure. Yes,
consider, we would consider that adult onset scoliosis, which is
right.
correctable. Okay. The other thing that I would do is that I would have you come here and I would have you on your knees. All right. Because I want to know, is there truly a leg length discrepancy? Because if there is truly a leg length discrepancy, it's going to be in your femur. And I can tell if I'm measuring you kneeling and I do the measurement on the back of your iliac crest, I can tell if there's one hip that's elevated more than the other, that's where the discrepancy is coming from. If you are dead on even, then I'm going to say, yeah, there's a leg length discrepancy. But
Uh-huh.
I would just say, because this is just like you've had to get the shoe lift as of late, and this wasn't something that happened after the injury. I would say some of it, you may have a leg length discrepancy, but more likely your body has compensated and compensated and compensated. Then all of a sudden, boom, it was like the overcompensation just got severe enough that you had to get the lift in.
Mm-hmm.
So my question would be is how much of a discrepancy is there actually? And
Mm-hmm.
how much can you correct that to get you back to where you were a year ago, 2 years ago,
Mm-hmm.
so that you may not necessarily have to have, the lift in the shoe
Right.
as much, right? And I mean, I see that too with people that have had a hip replacement, that they had a lift in their shoe because the hip was so bad that they hiked one hip up, and then they get the hip
Mm-hmm.
replacement. The doctor puts the hip in, they're totally level, but they forget to tell them to take the lift out of the shoe.
Yeah.
And now,
Yeah.
now they're crooked this way, and they've been walking around like this 2 years after their hip replacement, and have given themselves adult onset scoliosis.
Yeah.
I'm like, get the lift out of the shoe. And
Yeah.
so yeah, I've seen that happen as well.
All right.
Yeah.
Well, I think I pay you a visit.
Okay.
Yeah.
Sounds great. Anyone else?
Hey, Kari, it's
Hey.
Gwen. So, of course, watching these all, and I like, oh, I had that exercise. When I'm working, first of all, I wish I could get all of my clients to come see you first, right away at the beginning. That would be so helpful. But, I keep sending people there and they don't go. So, um, but what I'm wondering is when I'm working, especially with my older group, and this is something you and I could talk later. I mean, I'm doing certain exercises, and I would love to focus on exercises that address common issues with that population.
Hmm.
So, um, and and I may already be doing those, and it's really tweaking what I already know and things like
Hmm.
that. But does that sound like something that would be, I mean, doable, that I could pick a variety of things because of the age group that I'm working with?
Yeah, I mean, when you're dealing with older populations, especially when they have not been active, you can just automatically say frontal plane disparities, right? Like they're going to be leaning too far forward. Their
Yep.
chin's going to be way out.
Yep.
Their tailbone's probably tucked. So that's kind of like that's probably the first thing that's going to have to be addressed anyway. And, anything that you can do, if they can tolerate back extension, the things like anything, any kind of overhead extensions that they can do on the floor, pec stretches they can do on the floor, anything like that, if they can tolerate that with their back, to do that. If not, just lie, that static floor position, just
Yep.
lying on the floor with their arms out, and just
Yep.
feel, what can you feel? And look and see, does their head touch the floor? If not, okay, what are we going to do here in order to try to get that head to be not, for the head to not be quite so out of the frontal plane? And how do you get that back? And that could be just something as simple as just like, okay, we're just going to rotate our arms back and forth here. Or we're going to do some cervical rotations like this, and we're going to try to feel what you can feel with that. But yeah, you have to, I think, like, just that image of going from infancy to that first year where they're standing
Mhm.
is just understanding that they are an infant. Like somebody that's got really significant frontal plane discrepancies, they're in the infant stage, and you've got to get them so that they can lie flat, and then you can progress from that point.
I didn't even know that was a thing, that people couldn't put their, be flat on their back and couldn't put their head down, until I was working with John. And I said, just lie down and, put your head down. He says, well, I can't touch the ground. And I said, what do you mean you can't touch the ground?
Mhm.
I was flabbergasted. I've never seen that
Yeah.
before. So
Oh yeah.
yeah,
Yep.
he needs to come see you, but I know he won't do the
Well,
exercises.
yeah.
All right. Well, this
All
has
right.
been very helpful.
Okay. Well, I'm glad you all, thank you all for attending. I
Thank
really, really
you.
do appreciate it, and happy to help in whatever capacity I can. And just reach out if you have questions. I can send you to the Symmetry website if you want to look into it a little bit more. And happy to do that. But stay in touch, and it's been fabulous. And thank you again.
Thank
And I
Very,
will
you.
very
have,
well done, Kari.
thank you. And I will have this up on my YouTube site. If any, and it's just Kari Wilkinson on YouTube. So if anybody, if you want to, send anybody to that, you can also send them to the Symmetry website as well. So, and they can link to me from there. But if anybody just wants the general information about it, I'll have it up on my YouTube channel. Hopefully
Thank you.
in the not too distant future.
Thanks so much. I'll be sending people there.
Thank you. I appreciate you all.
You.
Have a great, happy
Thanks, Kari.
Halloween.
Yep,
Bye.
yep.